Healthcare is a rapidly growing sector of our economy that employs more than 18 million workers and is made up of both public and private sector organizations related to patient services, medical devices and manufacturers, and electronic health and medical records that store considerable amounts of personal information, making them frequent targets of attack. In recent years, increasingly sophisticated cyber attacks in the healthcare and public health sectors have posed alarming threats to people in Michigan as well as all across our country. Cyber attacks on hospitals and other healthcare providers can cause serious disruptions to their operations and prevent them from effectively providing critical, life-saving care to their patients. Breaches can also lead to the exposure of sensitive, personal, and medical information of patients and healthcare personnel. Most recently, the DC HealthLink, a health insurance marketplace for residents and lawmakers in the nation's capital, experienced a cyber attack that exposed the personal data and information of tens of thousands of people, putting victims at risk of identity theft, scams, and additional cyber attacks. Earlier this year, in my home state, the University of Michigan health system experienced a cyber attack that temporarily limited access to their public websites. Thankfully, in that attack, no patient information was compromised and the issue was quickly resolved. These relentless cyber attacks show that foreign adversaries and cyber criminals will stop at nothing to exploit cybersecurity vulnerabilities, our critical infrastructure, and most essential systems. What is most concerning about these attacks is that they don't just compromise personal information. They can actually affect patient health and safety. Last month, a ransomware attack on Tallahassee Memorial Healthcare in Florida took the hospital's IT systems offline for more than a week and required them to divert patients to other facilities and cancel procedures until they could restore those networks. In 2019, catastrophic ransomware attack on the Spring Hill Medical Center in Mobile, Alabama, may have even led to a patient's death. The attack prevented healthcare providers from using equipment to monitor a baby's condition during delivery. And as a result, the infant tragically passed away because of delayed medical care. This shocking example just shows how grave the consequences of cyber attacks in the healthcare sector can be. And given the threats facing this sector and the potential life or death consequences, there's no question that investments in healthcare cybersecurity are also investments in patient care. This committee has already taken an important step to strengthen cybersecurity for our critical infrastructure sectors, including the healthcare sector. Last Congress, the committee advanced a bipartisan bill that I introduced along with Senator Portman to require these organizations to report cyber attacks and ransomware payments to the Cybersecurity and Infrastructure Security Agency. This law will help ensure that government is able to better track cybersecurity threats to our critical infrastructure, provide more transparency and situational awareness for our cybersecurity defenses, and enable CISA to warn potential victims of ongoing attacks so they know if they could be the next target. This is an important first step, but there's much more for Congress to do to ensure that critical networks in our healthcare and public health sector remain resilient against cyber attacks.